Well, today we're going to talk about what is a direct anterior approach hip replacement. My name is Dr. Anthony Murray, and I am a hip and knee replacement specialist from Town & Country Orthopaedics. A direct anterior approach hip replacement refers to the method of accessing the hip to replace the joint. It is an approach I became familiar with during my surgical training and have since performed with surgeons across the world, both in Australia, Switzerland, the United Kingdom and Italy. It is an interval created between muscle layers that are at the front of the hip. The cut is a small, longitudinal incision for most patients, or an incision in the bikini line for patients who so desire. With this approach, no muscles need to be cut or tendons detached, and it is less invasive in this way than a traditional posterior approach hip replacement. As a result, patients can be more active and less restricted after their operation. My patients will have a three-dimensional CT scan performed approximately 3 to 4 weeks before their surgery, so we can have specialised, patient-specific technology available to utilise in the operation. This allows me to assess the anatomy, any potential differences or difficulties I may encounter, and plan for the correct implants to be utilised before we even get to the operating theatre. During the procedure, X-ray is used to ensure such things as leg length and the appropriate placement of implants to the position we have planned before the operation, and gives real-time feedback for optimising implants. Those people unsuitable for a direct anterior approach hip replacement may be those with pathology necessitating an alternative surgical approach, or those with significant obesity where access to the necessary landmarks for the operation are impaired. This would be discussed on the initial consultation where appropriate. The anterior approach allows for my patients a much quicker return to activity than the traditional surgical approaches. I hope you learn a little bit. Please leave a like and subscribe to this channel to receive more educational videos on hip and knee replacements.